You're lying in bed at 2 in the morning. Suddenly, you feel it. A tight, squeezing, burning sensation right in the center of your chest. Your heart starts racing. Your mind immediately goes to the worst possible place. Is this a heart attack? Should I wake someone up? Should I call an ambulance? The panic sets in, and somehow the panic makes the pain feel even worse. Sound familiar? Here's something that is going to completely change the way you think about chest pain forever. 8 out of 10 people who walk into hospitals with chest pain, 8 out of 10, have absolutely nothing wrong with their heart. Their ECG comes back normal. Their echocardiogram is perfectly fine. Even their angiogram shows no blockages, and yet the pain keeps coming back again and again and again, leaving them confused, frightened, and completely lost about what to do next. So if it's not the heart, what is it? And more importantly, how do you know the difference between pain that is genuinely dangerous and pain that, while deeply uncomfortable and frightening, is coming from somewhere far more treatable? That is exactly what this video is going to answer for you, completely, clearly, in a way that I hope removes a significant amount of the fear and anxiety you may have been carrying around this issue. I'm a gastroenterologist, and chest pain caused by digestive problems is one of the most common things I see in my practice every single week. People who have been to cardiologists, had every heart test imaginable, been told their heart is perfectly fine, and yet they still don't know why they keep getting this pain, and nobody has explained it to them properly. Today, I'm going to explain it properly. But before we go any further, I need to be absolutely clear about something. And please take this seriously. Any chest pain that is new, that is severe, that is persisting, you must never ignore it. You must always get it checked for a cardiac cause first. At minimum, go to your nearest clinic or hospital and get a basic ECG done. This is non-negotiable, especially if you have risk factors: diabetes, high blood pressure, high cholesterol, a family history of heart problems, or if you are a smoker. In these situations, always rule out the heart first. Always. No exceptions. This video is for those of you who have already done that, who have already been to the cardiologist and been told your heart is fine, or for those of you who have been experiencing the same recurring chest pain for months or even years and want to understand what else could be causing it. This video is going to give you answers, real answers. So let's get into it. Let me start by painting a picture that many of you are going to recognize immediately. You eat a heavy dinner, maybe a rich, oily biryani or something deeply spicy and indulgent. You lie down afterwards to relax and watch some television, and within 30 minutes, it starts. That burning, pressing, uncomfortable sensation right in the center of your chest. Sometimes it moves up toward your throat, sometimes it goes to your jaw, sometimes, and this is the one that truly terrifies people, it seems to radiate toward your arm. You sit bolt upright, convinced something is seriously wrong with your heart. But what's actually happening has nothing to do with your heart at all. What you're experiencing is acid reflux, or in medical terms, gastroesophageal reflux disease, commonly known as GERD. And it is, by a significant margin, the #1 cause of what doctors call non-cardiac chest pain. Chest pain that mimics a heart attack so convincingly that even experienced clinicians sometimes need tests to tell them apart. Here's the anatomy that explains why this happens. And once you understand this, everything will make sense. Your food pipe, your esophagus, runs right alongside your heart. They are immediate neighbors, separated by very little. When stomach acid escapes upward from your stomach back into the esophagus, that acid begins to irritate and inflame the delicate lining of your food pipe. And because the esophagus and the heart share many of the same nerve fibers, the brain receives pain signals that it cannot easily distinguish between the two. The result is chest pain that can feel burning or tight or squeezing, pain that can travel up to the neck, the jaw, and yes, even down the arm, in a way that is so similar to cardiac pain that the anxiety it triggers is completely understandable. This is the most important thing I want you to take from this first point. Acid reflux can produce chest pain that is genuinely indistinguishable from heart pain based on feeling alone. This is not you being dramatic. This is not hypochondria. This is real pain with real physiological causes, and it deserves real treatment. But the treatment is completely different from heart disease, which is exactly why getting the right diagnosis matters so much. Now let's talk about the second major digestive cause of chest pain. And this one affects even more people than acid reflux, because almost all of us have experienced it at some point. Excess gas and gastric distension. When you have large amounts of gas trapped in your stomach or intestines, whether from eating too fast and swallowing air, from drinking carbonated beverages like cola and soda, from eating very heavy, greasy, fried foods, or simply from significantly overeating, that gas creates pressure. The stomach expands, the intestines bloat, and all of this internal pressure pushes upward against the diaphragm and the chest wall. The result? Chest discomfort, tightness, heaviness, and pain that can feel very alarming, particularly when it comes on suddenly after a big meal. Here's the key distinguishing feature of gas-related chest pain, and I want you to remember this because it's one of the most useful clinical clues I can give you. If you burp, if you release that trapped air through belching, and the chest pain or tightness immediately improves or disappears completely, that is gastric pain, not cardiac. The heart does not get better when you burp. Gas does. Similarly, if passing wind from below gives you immediate relief from your chest discomfort, that is your digestive system releasing the pressure that was causing the pain. That is not a heart attack. That is trapped gas finding its way out of your body. This simple observation, does burping or passing gas relieve your chest pain, is one of the fastest, simplest ways to begin distinguishing between digestive and cardiac pain at home. Keep it in mind. Now, there is a third digestive cause of chest pain that is far less well known but incredibly important, and that is esophageal spasm. Your food pipe, just like your heart, contains muscle. And just like any muscle in your body, the muscles of the esophagus can go into sudden, intense, involuntary contraction. When this happens, the result is a squeezing, vice-like chest pain that can come on completely without warning and can last anywhere from a few seconds to several minutes. What makes esophageal spasm particularly frightening is that the quality of the pain, that deep, intense squeezing sensation in the chest, feels remarkably similar to what many people describe as a heart attack. It's no wonder that esophageal spasm has earned the nickname among gastroenterologists as the great imitator of cardiac pain. What triggers esophageal spasm? Stress and anxiety are major triggers, and we'll come back to the stress-gut connection in much more detail shortly because it is a critically important piece of this puzzle. Significant acidity, drinking very hot beverages, and emotional tension can all cause the esophageal muscles to go into spasm. If you've ever been in a highly stressful situation and suddenly felt an intense squeezing or tightening sensation in your chest that resolved on its own within a few minutes, there is a very real possibility that was your food pipe, not your heart. Let's move on to the fourth cause, musculoskeletal chest pain. Because this one is genuinely very common, and yet very few people consider it when they're in the middle of a chest pain episode. The chest wall is made up of muscles, cartilage, and ribs, all of which can become strained, inflamed, or irritated. The muscles that run between your ribs, called intercostal muscles, can go into spasm, particularly when you're under significant stress or tension, and produce a very sharp, localized, pricking pain that comes and goes. The distinguishing feature of musculoskeletal chest pain is its localization. You can often point to exactly where the pain is with one finger, and crucially, if you press on that spot with your finger and feel tenderness, if it hurts more when you press on it, that is a very strong sign that the pain is coming from the chest wall muscle or cartilage, not from the heart. Cardiac pain is not typically worsened by pressing on the chest. Musculoskeletal pain usually is. It's a simple but genuinely useful test you can do yourself. Now let's talk about gastritis and stomach ulcers, the fifth major digestive cause of chest pain that I see regularly in my practice. Most people, when they think of the stomach, imagine it somewhere down in the lower abdomen. But anatomically, the stomach is actually positioned quite high up, much closer to your chest than most people realize. When the lining of the stomach becomes inflamed from chronic stress, from regular alcohol consumption, from frequent use of painkillers and anti-inflammatory medications, from aspirin that many people take daily for heart protection, or from infection with a bacteria called H. pylori, the resulting pain and discomfort can be felt in the lower chest and upper abdomen in a way that causes genuine confusion. Gastritis pain typically has a burning or gnawing quality. It often worsens after eating certain foods, particularly spicy, oily, or acidic foods, or after drinking alcohol. It may worsen on an empty stomach and improve temporarily after eating. If you are regularly taking painkillers or anti-inflammatory drugs, or if you drink alcohol regularly, or if you've been under prolonged periods of significant stress, gastritis or a developing stomach ulcer should absolutely be considered as a possible source of your chest discomfort. And then there is the sixth cause, one that tends to produce a very different type of pain that is often misidentified as cardiac: gallbladder stones. Your gallbladder sits tucked underneath your liver, right below the right side of your rib cage. When gallstones cause a blockage or trigger a gallbladder attack, the pain that results can be extremely intense. A severe gripping pain in the upper right abdomen or the upper center of the abdomen that can radiate through to your back or between your shoulder blades. What makes gallbladder pain particularly deceptive is its intensity. It can be so severe, so overwhelming, that people genuinely believe they are having a heart attack. The pain of a gallbladder attack can last anywhere from 30 minutes to 2 hours. It is often accompanied by nausea and vomiting, sometimes violent vomiting of yellow bile. It frequently comes on after eating a heavy fatty meal. If you have experienced this specific pattern of severe upper abdominal pain that radiates to your back, accompanied by vomiting, triggered by fatty food, please see a doctor. An ultrasound scan can easily identify gallstones, and once identified, they are very treatable. Now, and this is the section that I believe many of you have been waiting for. Let me give you the practical clinical tools to help you begin distinguishing between pain that might be coming from your heart and pain that is more likely coming from your digestive system. I must emphasize one more time before I do this. These are clues and differentiators to help you think more clearly in the moment, not a replacement for medical evaluation. If you have any doubt, get an ECG always. But here are the patterns that gastroenterologists and cardiologists use to think about this differentiation. Pain that is more suggestive of a cardiac origin tends to come on with physical exertion. Walking uphill, climbing stairs, exercising, doing anything that raises your heart rate. That is when cardiac pain typically appears. And when you stop and rest, the pain eases. This is the classic angina pattern. Pain triggered by exertion, relieved by rest. If your chest pain consistently follows this pattern, please see a doctor promptly. Cardiac pain is also often associated with other symptoms. Sweating, particularly cold sweating that seems disproportionate to what you're doing. Shortness of breath, a feeling of increasing tightness that builds progressively and does not go away. Pain that is diffuse, meaning you cannot point to a single specific spot, and that radiates continuously to the left arm. Pain that has absolutely no relationship to what you have eaten or whether you have recently had a bowel movement or released gas. If your chest pain has these characteristics, particularly if it is new, if it is building in intensity, if it is associated with sweating and breathlessness, do not wait. Get to a hospital immediately. Pain that is more suggestive of a gastric or digestive origin has a very different set of characteristics. It tends to come on after eating, particularly after heavy, rich, spicy, or greasy food. It responds to simple interventions. If a glass of buttermilk, a glass of water, or an antacid syrup makes your chest pain significantly better or completely resolves it within minutes, that is digestive pain. Antacids do not treat cardiac pain. The heart does not respond to milk of magnesia. Gastric chest pain is often relieved by burping, by passing wind, or by walking around, all of which help to move trapped gas through your digestive system. It tends to be worse when you lie down and better when you sit upright or stand and move around, because lying flat allows stomach acid to flow more easily back up into the esophagus. If your pain is a very sharp, brief, stabbing sensation lasting only a few seconds in a very specific localized spot, it is extremely unlikely to be cardiac in origin. The heart does not typically produce pain of that character, and if the pain is clearly localized to a point where you can press with one finger and feel tenderness, that musculoskeletal pattern points away from the heart. Now I want to spend some time on something that connects almost everything we've discussed, and that is the profound bidirectional relationship between your gut and your brain. Because once you understand this connection, the reason why stress, anxiety, and emotional distress so consistently produce genuine physical chest pain will make complete and total sense. Your gut contains what neuroscientists have begun calling the second brain, a vast network of over 100 million nerve cells that lines your entire digestive tract from your esophagus to your rectum. This network, called the enteric nervous system, is in constant, real-time communication with your brain through a pathway known as the gut-brain axis. What happens in your brain affects your gut. What happens in your gut affects your brain. They are not separate systems. They are one deeply interconnected system. When you experience stress, workplace pressure, relationship difficulties, financial worry, grief, anxiety, fear, your nervous system responds immediately. Your body releases stress hormones. Your digestive system, receiving these signals directly, responds by increasing acid production in the stomach, triggering spasms in the esophagus and intestines, slowing down or speeding up gut motility, and increasing sensitivity to pain throughout the entire digestive tract. All of this can directly produce chest pain, burning, tightness, bloating, and every other symptom we've discussed, purely as a physical response to emotional stress. This is why so many people notice that their chest pain and digestive symptoms are significantly worse during periods of high stress, poor sleep, or significant anxiety. It is not imagined. It is not weakness. It is a genuine physiological response, your gut responding to your mental and emotional state in a way that produces real, measurable, physical symptoms. And this connection works in the other direction too. Chronic digestive discomfort, especially recurring unexplained chest pain, causes significant anxiety. People lie awake at night worried about their heart. They avoid exercise for fear of triggering a cardiac event. They restrict their diet out of anxiety rather than medical advice. This anxiety then makes the digestive symptoms worse, which makes the anxiety worse, which makes the symptoms worse. It becomes a vicious cycle that is genuinely difficult to break without understanding what is actually happening. Understanding that your chest pain is coming from your digestive system, not your heart, genuinely breaks part of that cycle because knowledge reduces fear. And reduced fear reduces the stress response. And reduced stress response means less acid, fewer spasms, less bloating, less pain. This is why I said at the beginning of this video that what you're about to learn can help get rid of a lot of anxiety about chest pain, not just intellectually, but physiologically. Now let's talk about what is causing these digestive problems in the first place, and particularly about the Indian lifestyle patterns that I see directly contributing to these symptoms in my patients every single day. Eating late at night is one of the most significant contributors. When you eat a heavy meal close to bedtime and then lie down, you are giving stomach acid the perfect opportunity to flow backward into your esophagus. Gravity normally helps keep acid in the stomach. Lying down removes that advantage completely. Eating a large, rich, heavy dinner at 10 or 11 at night and then going to bed an hour later is practically a guaranteed recipe for acid reflux and the chest pain that comes with it. Eating very spicy, oily, and greasy foods, particularly late in the day, dramatically increases acid production and slows gastric emptying, both of which worsen reflux and bloating. Having tea or coffee on an empty stomach irritates both the esophagus and the stomach lining directly, increasing both acid production and sensitivity to pain. Long gaps between meals, irregular meal timings, and the common pattern of eating very little during the day and then one enormous meal at night. All of these disrupt the normal rhythm of your digestive system and create the conditions in which all of these symptoms thrive. Frequent use of painkillers and anti-inflammatory medications, ibuprofen, diclofenac, aspirin, is another very significant factor that I see causing gastritis and chest pain in my patients regularly. These medications directly damage the protective lining of the stomach and esophagus with prolonged use. If you are taking these medications regularly, please discuss this with your doctor because there are ways to protect your stomach while continuing necessary pain management. And alcohol, even moderate, regular social drinking, irritates and inflames the esophagus and stomach lining, worsens acid reflux, and over time can contribute to all of the digestive conditions we've discussed. If you are experiencing recurrent chest pain and drinking regularly, this is an important variable to consider. So what can you actually do about all of this? What concrete, practical changes can you make starting today that will reduce or eliminate these digestive causes of chest pain? The first and most impactful change is to stop eating large, heavy meals. Instead, shift to smaller, more frequent meals throughout the day. Your stomach can manage smaller amounts of food much more comfortably than it can manage one or two enormous meals, and a less overloaded stomach produces less acid and causes less reflux. Make your dinner the lightest meal of your day, not the heaviest. This is the opposite of what many Indian households traditionally do, but it is one of the single most effective changes you can make for your digestive health. And finish your last meal of the day at least 2 to 3 hours before you go to bed, ideally by 8 or 8:30 in the evening. Give your stomach time to begin digestion before you lie down. Cut down significantly on oily, very spicy and heavily fried foods, particularly in the evenings. Reduce or eliminate carbonated drinks completely. The carbon dioxide in these beverages causes immediate gastric distension and directly triggers the kind of gas-related chest pain and bloating we discussed earlier. If you take afternoon naps, which many people in India do, avoid lying completely flat after eating. If you want to rest after lunch, recline in a chair rather than lying flat on a bed. Lying flat in the first 2 hours after a meal is one of the most direct ways to trigger acid reflux and the chest discomfort that follows. If you smoke, I want to be direct with you about this. Smoking is a risk factor for both heart disease and for the digestive causes of chest pain we've discussed. Nicotine weakens the lower esophageal sphincter, the valve that is supposed to prevent stomach acid from flowing back up into the esophagus. Quitting smoking benefits your heart, your lungs, and your digestive health simultaneously. It is the single most impactful health intervention most smokers can make. And physical activity, regular consistent movement, has profound benefits for your digestive health that most people are completely unaware of. Exercise improves gastric motility, meaning it helps food move through your digestive system more efficiently. It reduces bloating and gas. It significantly reduces acid reflux symptoms in many people. And crucially, it is one of the most evidence-based treatments available for stress, anxiety, and the sleep problems that so directly worsen digestive symptoms. 30 to 40 minutes of walking 5 days a week helps your gut, your heart, your mental health, and your sleep quality, all of the factors that are interconnected in this cycle of digestive chest pain. Let me bring everything together now and give you a final clear summary of where things stand. Chest pain is frightening. There is no question about that. The moment you feel that tightness or burning in your chest, the fear of something going wrong with your heart is immediate and overwhelming. And I want to be very clear. that fear is completely understandable, and the first response to any new or severe chest pain should always be to rule out a cardiac cause. Get an ECG, see a doctor. Never take chances with your heart. But here is the equally important truth. 8 out of 10 people with chest pain have nothing wrong with their heart. The pain is real, genuinely physically real, but it is coming from your digestive system, from acid reflux that irritates your food pipe right next to your heart, from gas that pushes upward against your diaphragm, from esophageal spasms triggered by stress, from gastritis inflaming your stomach lining, from gallstones, from musculoskeletal tension in your chest wall. All of these are treatable. All of these can be improved, often dramatically, through the right diagnosis, the right lifestyle changes, and in some cases, the right medical treatment. If your chest pain has been going on for months or years without any cardiac explanation, it is not a mystery. It is a digestive problem that has gone unaddressed, and it is very likely something that can be significantly improved with the information and the changes we've discussed in this video. Getting the right diagnosis removes the fear, and removing the fear is genuinely part of the treatment. If this video helped you understand something about your chest pain that you hadn't understood before, if it answered a question you've been carrying for months or even years, then please take 1 second right now and hit the like button. It is the most powerful way you can help this information reach more people who are lying awake at night, frightened about chest pain that nobody has properly explained to them. Drop a comment below and tell me, have you experienced chest pain that turned out to be digestive in origin? How long did it take you to get the right answer? Your story might be exactly what someone else watching this video needs to hear to finally stop being afraid. I read every comment, and your experiences genuinely matter to this community. And if you want to continue receiving honest, science-based, practical information about your digestive health and overall well-being, from a gastroenterologist who believes you deserve real answers, not generic advice, subscribe to this channel right now and click the bell icon so you're notified every time we publish a new video. Because your gut has been trying to tell you something, it's time to start listening.